I'm Dr. Rogers and I do hair transplantation surgery. There are two main types of hair transplantation surgery. One is known as a strip method, where you take a strip of the hair and skin from the back of the head. And the other method is the FUE method, or follicular unit extraction method, where instead of taking a strip of the hair, you take out the individual hair roots one at a time. In essence, you are doing the same process, but essentially the results and the actual technique does leave slight differences between the two. Male pattern hair loss is fairly straightforward. It is essentially a genetic cause where men are susceptible to a hormone called DHT, which will gradually over time cause the hair loss in a very distinctive pattern, which is a very different pattern to female pattern hair loss, and the causes are also different. But generally speaking, in male pattern hair loss, it's usually treated with either surgery, medication, or sometimes hair pieces and the like. The main non-surgical solutions really are the medications, and these include minoxidil lotion and finasteride tablets, which can be used in conjunction with each other or separately. Both of these treatments have been around a long time, since the 70s, and have been well proven to work effectively in male pattern hair loss. The difference between the two of them essentially is that minoxidil is more of a stimulant type of treatment, whereas you could say that finasteride tablets almost start turning back the clock and make the hair much sort of thicker, almost younger in appearance, as well as essentially stopping further hair loss as well in approximately 8 out of 10 men. It's also become common for women to have hair transplantation surgery as well, not just for female pattern hair loss, which would be treated very much in the same way as male pattern hair loss, but also such things as eyebrow restoration if they have overplucked their eyebrows, or eyelashes, again, perhaps if due to trauma or accidental overplucking of the eyelashes as well. And more recently as well, even restoring the sideburn area if female patients have had facelifts and they've lost some of that hair there. Although hair transplantation surgery is minor surgery performed under local anaesthetic, any form of surgery can of course have some form of complications. Fortunately, it's relatively uncommon and certainly almost unknown to have any serious complications with hair transplantation, but commonly the issues would be minor stitch infections, scarring where it's not quite as easily concealed as normal, and occasionally the hair regrowth is not as good as expected. Most patients need to take a certain amount of time off work, usually around 1 to 2 weeks, depending of course on what sort of job you're in as well. Most patients feel it's much less painful than going to the dentist, for instance. It will be a little bit sore afterwards, of course, but actually at the time itself, it shouldn't be at all painful apart from the first couple of initial local anaesthetic injections, and that would be that. The aftercare for hair transplantation surgery is usually pretty straightforward. The first 3 or 4 days is critical, and that's when you have to be very careful, of course, with your head. After that, you are soon getting back to normal with hair washing, blow drying, styling, any of those things can be performed again by 5, 6, 7 days onwards, really. The average time it takes hair to come back through again from the first procedure is usually about 3 to 4 months, but the final result will take a good sort of 12 months or so to fully appreciate the results.